Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also Associate Professor of Medicine. Today we're going to talk about bitter gourd or Karela and what complications you can develop after drinking it. We have done a lot of research and went into the research mode and collected all the information. That's what our topic is. Before we talk, we did do a video a few days ago about the benefits of Karela juice or bitter gourd in anti-diabetic. A lot of benefits you got. Definitely a lot of properties against diabetes and even cancer. But today we're going to look at what complications you can have. Now, when we talk about complications, it's not our plan to put Karela juice down, but it's to educate people. Some people, unfortunately, is going to have complications no matter what you do. Less like allopathic medicine. If you take some medicine, some people don't develop complication. Majority of the people don't have complication, but small number of people can have complication. Today we're going to tell you all about what complications we've seen it develop after taking bitter gourd or Karela juice. Okay, the first case was published in the World Journal of Emergency Medicine. A 52-year-old started vomiting blood, and then she ended up in the hospital. She went into shock. Her blood pressure dropped down, and then she was giving a lot of IV fluid. They did a scope, light through the stomach, and looked at it. It was plenty of inflammation causing her bleeding. Okay, so vomiting. That's the first case report, and the second case report was published in the Journal of Family Medicine with the primary care. Let's look at it. A 64-year-old female, again multiple vomiting, a lot of blood also. She went into shock. The important point is the symptoms develops after 30 minutes after she taking this bitter gourd juice. Another bottle gourd toxicity, which is a rare case report. The authors are saying, let's see what happened. In this case, a 62-year-old male, severe vomiting, diarrhea, again shock. In this case, it took only like 3 minutes for this person to have developed symptoms. Fortunately, she was into the hospital. She was treated with IV fluids. Another case report in Open Journal of Emergency Medicine in December 2023, bitter bottle gourd toxicity. Let's look at this. I have a 78-year-old woman started with abdominal pain, diarrhea, and vomiting. So the main symptom in her, abdominal pain, diarrhea. Then she lost consciousness. She drank only 1/3 of the juice, and then she developed complications. Let's look at the next one. A woman get rare cause of toxic squash syndrome after drinking bitter gourd. That's what they say. And a 64-year-old woman. And this is kind of interesting. They have a picture, this case report talking about bitter gourd, but the picture is not bitter gourd or something else. Okay, so we don't know exactly. I have some of the things, but again, this is not, some of them you cannot trust, some of them cannot trust. You look at the picture, right? It's not bitter gourd right here. I don't know what they're reporting. So we're going to ignore that thing because maybe they got a picture from somewhere else. Let's look at the other one. Bitter gourd toxicity is published in the Journal of Emergency Medicine. And this family of 5 adults, my friend, 30 minutes after the difference over here, they did not drink the juice. They ate the cooked bitter gourd. Okay, and then after that they started having developed 5 to 20 minutes, and usually there are a lot of reports when you cook the toxicity goes down, but unfortunately in this case it still develops symptoms, diarrhea, hypotension, and vomiting blood. So that is something different about it. Then another case developed, it was treated. Most of the people end up going to the emergency room. A 41-year-old man, multiple vomiting, hematemesis. Again, all of these people treated with IV fluid. They need a lot of fluid. The reason for that, they were vomiting, diarrhea, and all that. Next one again. This is an interesting. There's 15 cases. They put a case series to report. Let's say find out what are their symptoms. They've developed abdominal pain, vomiting, hematemesis, diarrhea, and hypotension. It took 15 minutes to 6 hours in this group. The symptoms developed. This is the longest I have seen. 6 hours to have developed the symptoms. Again, a lot of inflammation in the stomach when they looked at it. Started with, treated with IV fluids. Then there's another case report, a 78-year-old woman vomiting, loose stool, diaphoresis, and treated with again IV fluids and the bitter gourd poisoning. Another case report, bloody diarrhea in this patient, a 59-year-old male, oliguria, that means having renal problem, renal shutdown, 30 minutes. So again, she was treated with 4 liters of IV fluid. So let's look at by looking all this case report, what we found out, what symptoms you can have if you're developing complications. One, you can have severe abdominal pain, you can have vomiting, you can have diarrhea, you can lose consciousness, you can have gastrointestinal bleeding. Remember, most of these people were vomiting blood, okay? Oliguria, renal shutdown, you get shock, and then your blood pressure goes down, and it was fortunately all of them went to the hospital and got treated. So again, it's important to know, again, we're not trying to put the chlorella or bitter gourd juice down, but you need to know, my friends, if some people can develop complications. This may be rare complications, but better get educated, okay? And when I make presentation like this, I always like, comments like, oh, which pharmaceutical company paying you and all that thing. I'm not supported by any pharmaceutical company. I'm telling what's the research out there. So next time, if somebody taken juice or like cooked product or chlorella develops some kind of complication, think about it. It may be a serious situation, okay? None of any of the product you take is not safe. Some of them can have complications. Always remember that majority of them might not have complications. Thank you so for watching. Thank you so much. Again, please subscribe and support our channel. It's very, very important so we can make more videos like that. God bless.